Welcome, health enthusiasts and curious minds. Get ready to embark on a journey of self-discovery like never before. We've got an exclusive inside look at the 13 secret health warnings your body has been whispering to you. You won't believe what your body's been trying to say all along. These hidden signs, often overlooked, hold the power to transform your well-being. From subtle hints to stealthy alarms, they're all right here, waiting to be uncovered. Buckle up, because you're in for a health revelation you won't want to miss. It's time to take control of your health journey. Join us as we dive deep into these covert health warnings and let your body's messages lead the way. The secrets are about to be unveiled. Stay tuned and don't miss a second. Although your body is a sophisticated and wonderful system that is capable of many things, it can occasionally give you warning signs that something is wrong with your health. These warning symptoms could be indicators of more significant issues that require medical treatment, even though they might be mild, silent, or simple to ignore. These are 13 subtle indicators that your body is trying to alert you to a problem, along with suggestions for what to do if you notice them. Now let's get going. 1. Unintentional weight loss. Richard Wender, MD, Chief Cancer Control Officer, American Cancer Society, says get it checked out if you've lost more than 10 pounds without changing your diet or exercise routine. The most common causes of unexplained weight loss include lung, stomach, esophageal, or pancreatic cancers. It might also indicate intestinal issues, thyroid issues, or diabetes. 2. Tearing sensation in your back. An aortic dissection, a potentially fatal disorder, may be the cause of a tearing feeling in your back that is unrelated to any physical exertion or injury. The biggest artery in your body, the aorta, breaks its inner layer at this point, forcing blood to flow between the layers and driving them to separate. This may result in an aortic rupture or decreased blood supply to essential organs. Aortic dissection can result in symptoms similar to a stroke, including intense back or chest pain, perspiration, dizziness, and shortness of breath. 3. Itchy blistery skin rash. A rash that appears to be eczema but does not improve with lotions or ointments may indicate celiac disease. Gluten, a protein included in wheat, barley, and rye, causes an immunological reaction in people with PSO's illness that destroys the small intestine. Antibodies that accumulate beneath the skin create dermatitis herpetiformis, the rash. This rash affects about 25% of individuals with celiac disease, and many of them do not experience any stomach symptoms. Celiac illness can only be managed with a rigorous gluten-free diet. 4. Damage to your teeth. If your dentist observes that the enamel on your teeth is worn down, particularly in the rear of your mouth, this may indicate acid reflux. Acid reflux is a medical disorder characterized by the reflux of stomach acid back into the esophagus and mouth, leading to heartburn, dyspepsia, and erosion of the teeth and throat. Although many acid reflux sufferers have no symptoms, they run the risk of developing esophageal cancer. See a gastroenterologist for a diagnosis and therapy if you experience recurrent or chronic heartburn, coughing, wheezing, or a sour taste in your mouth. 5. Changes in handwriting. Parkinson's disease may be indicated if you see that your handwriting has gotten smaller, more clumsy, or less readable than it used to be. Parkinson's disease is a neurological condition that impairs muscular coordination and movement. Micrographia, or minuscule handwriting, is one of the early indicators of Parkinson's disease. Tremors, stiffness, slowness of movement, issues with balance, and loss of facial expression are some other symptoms. Let us know whether you're enjoying this video before moving on. Remember to hit the subscribe and like buttons on the channel. It truly is helpful to us and informs us of the kind of stuff you would want to see more of. 6. Swollen feet or ankles. Swelling in your ankles or feet may indicate edema or fluid retention. Numerous things, including prolonged standing or sitting, excessive salt consumption, pregnancy, and menstruation, can result in edema. It may also indicate more serious issues such as blood clots, liver illness, renal disease, or heart failure. You should consult a physician if your swelling is severe or chronic, or if you experience other symptoms, including weight gain, chest pain, or shortness of breath. 7. Yellowing of the eyes or skin. Jaundice may be indicated if you observe that your skin or eyes have become yellowish in color. An excessive amount of the yellow pigment bilirubin in your blood causes jaundice. When red blood cells degrade, bilirubin is created and is typically removed by the liver. Jaundice may be indicative of cirrhosis, liver cancer, or hepatitis. Hemolytic anemia, pancreatic cancer, and gallstones are further possible causes. It is important that you visit a doctor right away if you have jaundice. 8. Snoring. Although it might not seem like a big deal to you or your partner, snoring could be an indication of sleep apnea. The condition known as sleep apnea causes frequent stopping and restarting of breathing while you sleep. Your blood oxygen levels may drop as a result, which may impair the quality of your sleep. Your chances of depression, diabetes, heart disease, stroke, and high blood pressure can all be exacerbated by sleep apnea. You should get a sleep study from your doctor if you have loud snoring, gasp for air while you sleep, or feel exhausted or drowsy during the day. 9. Frequent urination. It may indicate diabetes if you find yourself using the restroom more frequently than normal. When you have diabetes, your body either doesn't create enough insulin or doesn't use it properly, which results in excessively high blood sugar levels. You may become dehydrated and thirsty from having high blood sugar, which may increase your urination. Increased hunger, exhaustion, blurred eyesight, sluggish wound healing, and tingling or numbness in the hands or feet are some other symptoms of diabetes. 10. Persistent cough. A cough that persists for more than 3 weeks may indicate TB, pneumonia, or bronchitis, among other respiratory infections, but it can also be an indication of lung cancer. Globally, lung cancer is the primary cause of cancer-related mortality in both men and women. Until it has spread to other areas of the body, it frequently exhibits no symptoms. Chest pain, breathing difficulties, wheezing, hoarseness, bloody sputum, and unexplained weight loss are other indicators of lung cancer. You should consult a doctor if your cough is chronic and does not go away with over-the-counter drugs or home remedies. 11. Difficulty swallowing. Dysphagia may be indicated if swallowing food or drinks causes difficulty. A disorder known as dysphagia affects the nerves and muscles that regulate swallowing. Numerous conditions, including aging, stroke, brain trauma, nerve loss, and muscular diseases, can result in dysphagia. Nevertheless, it may also indicate more severe issues, including thyroid, throat, or esophageal cancer. In addition to choking, coughing, drooling, regurgitation, or weight loss, dysphagia can cause these symptoms. If your trouble swallowing persists for more than a few days or becomes a daily struggle, you should consult a physician. 12. Changes in moles. If you have skin moles, you should regularly examine them to see if there have been any changes in texture, color, size, or shape. These alterations may indicate melanoma, a type of skin cancer. The most serious kind of skin cancer is melanoma because, if left untreated, it can spread to other parts of the body. If you observe any changes in your moles, you ought to consult a dermatologist. 13. Changes in bowel habits. A digestive disease may be indicated if you experience any abnormalities in your bowel habits, such as diarrhea, constipation, blood in your stool, or changes in the color, consistency, or form of your stool. Irritable bowel syndrome, IBS, diverticulitis, inflammatory bowel disease, IBD, hemorrhoids, and anal fissures are a few prevalent digestive problems. On the other hand, alterations in bowel patterns may also indicate colorectal cancer. Globally, colorectal cancer ranks third among cancer types that affect both men and women. Until it has progressed to later stages, it frequently shows no signs. Abdominal pain or cramps, bloating, gas exhaustion, or unexplained weight loss are further indicators of colon cancer. If you have any changes in your bowel habits that last longer than 2 weeks or are accompanied by other symptoms, you should see a doctor. Let me know in the comments below. What do you think? Thanks for watching.